This is Agriculture Today, and I'm Shelby Varner with the K-State Radio Network. Today's show begins with Megin Nichols, a veterinarian and public health leader that is this year's Henry C. Gardiner Lecturer, as she explains her One Health approach. She discusses the relationship between animal and human health and also mentions times when biosecurity and health is sometimes forgotten. K-State dairy specialist Mike Brouk ends the show saying dairy producers who aren't testing the level of immunoglobulins in colostrum are just guessing as to whether the calf receives enough to result in effective passive immunity. That and more is coming up ahead on Agriculture Today. You're tuned in to Agriculture Today, and we start our show talking with the 2025 lecturer for the Henry C. Gardiner Global Food Systems Lecture Series, Megin Nichols, who is a veterinarian and public health leader with extensive experience in the intersection of human, animal, and environmental health. Megin, thanks for joining us today.
Thank you so much. It's great to be here.
Megin, can you tell us a little bit about yourself and the work you do?
Absolutely. So I am originally from the great state of New Mexico. We call it the land of enchantment. And I grew up out on a 40-acre ranch, pretty much in the middle of nowhere, and always had an affinity for every animal that wandered across the property, and a real appreciation for how our food came about. So I grew up from a very early age understanding that cattle were raised for food purposes, and same with chickens. They produced the eggs and the meat. But I came to realize pretty early on that not everybody had an appreciation or even an understanding of where our food came from. So I had a lot of friends growing up. I went to school in Santa Fe, so commuted about an hour to get to school in the city. And I started to realize that many of my friends had no idea what it was like. Or if you say, I've got to go home and I've got to do chores, I can't hang out, they didn't necessarily have the same types of chores that I did. And so I grew to really appreciate that. I wanted to be a veterinarian from a very young age. And so subsequently pursued a degree in animal science at New Mexico State University, and then went on to get a degree in veterinary medicine from Colorado State. And I was about part of the way through my veterinary school and doing some studying there. And I thought, gosh, I really like this idea of working on animals, but I really also want to help people. That is one of my big passions. And so I had a wonderful professor, Dr. Hill, at Colorado State at the time, and she started talking about public health and how there were a lot of veterinarians that also had degrees in public health. And they brought this unique perspective so they could tie the animal health to the human health. And I found an opportunity at the University of Minnesota where they had a master's in public health program in food safety and biosecurity. And so I pursued that. And that really set me on my journey to pursue a career in what I'll call One Health, which is the recognition that the health of humans, animals, and the environment are all tied together.
And your lecture titled Where Animals, Data, and Decisions Meet, a One Health Journey. And how have you really pushed that forward and made it a One Health journey?
I think a lot of it is the recognition, just as when I was a child, that a lot of my friends didn't necessarily have an understanding of where our food came from or agriculture in general. I think that's something that has really followed me throughout my career. And so I'm going to talk about a little bit in my lecture tonight. So to preview that, about how there's a study that came out that actually said that some people believed that chocolate milk came from brown cows. I'm sure many of us have heard that. We kind of chuckle about it. But I think in some ways that represents that we don't necessarily have the level of agriculture literacy that is really helpful for people. And so throughout my career, I've seen that in a variety of ways. So I work primarily on the intersection of diseases that affect people and animals. And so sometimes people are surprised when, say, there's a COVID-19 pandemic, and all of a sudden there's discussions about whether or not there's going to be an adequate supply of meat on the shelves. And so so they don't necessarily recognize where the food comes from and all of the different elements and factors that go into the production of that food. I think similarly, what we saw with avian influenza when it came about was that there was a discussion about egg prices. And so I think a lot of people didn't necessarily have as much awareness that a disease that primarily was affecting poultry and some dairy cattle, but not really affecting humans in terms of an infectious disease, led to effects on the grocery store shelves and a conversation about that. So I think that's something that I really like to bring awareness of and tie together. I think there's also a lot of work that is interesting looking at the environment side. So looking at land use and soil conservation and looking at some of the emergence of fungal diseases in people. So I know there's a lot of pop culture and TV shows that are emerging about that. But I think that's an interesting area of conversation as well.
You mentioned agriculture literacy as you were growing up in agriculture, but is that something you've seen at many levels of your career and life?
Every single one. And so I think one of the things that has been really, really important for me is to continue to invest in learning more about things we don't know. So if I work in a job where I'm going to, say, investigate foodborne illness, and I've worked at state health departments, done internships at local health departments, and I've worked at the federal level doing these types of investigations. And so it's one thing to investigate the illnesses and say, okay, it likely came from this product or this restaurant or those types of things. But then usually the goal is to prevent them from happening in the future. So you're faced with making recommendations about what that food company, what the industry should do to prevent it from happening. And I think one of the really challenging things that is actually dangerous is if you lean too far into making those recommendations without a true understanding and collaboration with either the food industry or the producers. So my goal in One Health is really to recognize that things that we all want, say food, we want our food supply to be secure. We want to have enough food to feed people. That really takes a partnership. It can't just be one-sided in that conversation. And that is something that has certainly followed me throughout my career.
How have you helped make it hopefully not one-sided?
Well, I think one of the things that I have a big interest in is investing in a lot of the organizations and associations that are conveners that say, well, look, here are some groups that have very different opinions or ideas on a certain topic. So I've worked a lot on antimicrobial resistance, also known as antibiotic resistance. And that is when, maybe a drug we have to treat a certain type of infection no longer works because the bug or the germ has actually become resistant to it. It's developed the ability to not be killed by that drug. And for a long time, there was a conversation that was largely slanted towards this issue being associated with agriculture. And I think it's taken us a lot of time and a lot of energy to actually say, wait a minute, let's recognize that any time antimicrobials are used, there's an opportunity for resistance to develop. And indeed, some of these bugs are naturally resistant to certain antimicrobials. So let's bring both of those perspectives in, and then let's talk about what's actually feasible. Because what you miss is the animal welfare component. These antibiotics and other things are oftentimes used when animals are sick, and we don't want animals to be sick. So how do you actually bring those two pieces together? We don't want antimicrobial resistance. We don't want sick animals. So we need to be able to bring those two perspectives together to have a conversation that is productive and recognizing where the disagreements are, but also where there is agreement and where there may be a path forward to look at new ways of doing things or new ways of looking at the data and the science. And I think that's really, really important and something that I've not shied away from in my career and actually found to be really productive. I love hearing the thoughts, opinions, data, and voices that are different from mine because really that's the only way we learn.
As we're thinking then about that intersection between animal and human health, which comes first, animal health, human health, the chicken before the egg? How does that work out when we're thinking about zoonotic diseases?
I think in certain ways it's both. early in my career, one of the things that really got me excited about zoonotic diseases is I was in veterinary school and I had the opportunity to attend a lecture. And the lecture was being presented by somebody who was doing a study to look at people who lived in New Mexico and Arizona and had gotten plague. Now, this is like the Black Death plague from Europe. And I was thinking, oh my gosh, first of all, this is still around. And then second of all, how is this happening in New Mexico? How are people getting it? And what this researcher had found was that people who allowed their pets, their dogs and their cats, but especially their dogs, to sleep in their beds with them after going out and hunting in rodent burrows, and the dogs were not on any type of flea control, they'd bring the fleas in, they'd sleep with the people, fleas would actually bite the people and potentially infect them with plague. And my mind was blown about that. But you have to look at not only the human and the animal, but also the environment piece. So maybe the answer to your question is it seems like all of the above, right? Because a lot of these people were moving into areas, mountainous areas with juniper pinon coverage, and they didn't realize that this was actually the natural habitat for those types of rodents. Prairie dogs, rock squirrels, mice. And so those animals carry diseases. If you build a house that's right on top of their burrow, of course, there's potentially going to be disruption. Or let's say you put a garden out right beside your house or a log pile beside your house. That's a great habitat for them. They're going to get closer. Then when you have your animals, it's really important to keep your animals healthy and prevent them from getting sick. So just utilizing something like routine flea and tick prevention. And then lastly, having your pet sleep with you. And I know that many of us who shall remain unnamed probably do this. We probably let our dogs sleep in our beds. But just making sure that if you're doing that, that you're aware that they need to be on the flea prevention and that this could potentially be a risk. And if you were to develop swollen lymph nodes and a really high fever and live in that area in New Mexico, you should be talking to your doctor about, hey, could this be something like plague? So I think it's all of the above. You have to make sure you're aware of your environment. You have to make sure you're aware of how to keep your pets healthy. And then what are the potential ways to prevent those things so that people don't get sick?
We're cutting to a short break now, but we'll be right back as we continue our conversation with Megin. You're tuned back into Agriculture Today as we continue our conversation with Megin Nichols, who is a veterinarian and public health leader with extensive experience at the intersection of human, animal, and environmental health. Megin, in the last segment, we wrapped up discussing the Black Plague and New Mexico. And are there other things that people just don't seem to think about, or maybe it just slips their mind when it comes to human and animal health?
Backyard chickens.
What about with backyard chickens?
Well, in terms of agriculture, I think owning and raising backyard chickens is actually a really great opportunity to get involved in agriculture, right? Especially if you have kids that are a little bit older, there's an opportunity for them to learn all about how to care for animals, their feed, their upkeep. I mean, there's no better way to look at feed conversion to egg production, right? It's a very, very closely related thing that you can visualize with these backyard chickens. But I think a lot of people think, and this happened especially during the pandemic, there were potential conversations about meat and egg shortages. So a lot of people went out to their local ag supply store, bought backyard chickens, brought them home, but maybe had no idea about all of the work that goes into caring for a food-producing animal like a chicken. So, number one of the things that you'll read about in the national data is that there were a lot of salmonella infections, especially in children, because people go in, they pet the chickens, they kiss the chickens, they hug the chickens, they might collect the eggs and not wash their hands, or clean the coops and not wash their hands. They might wear the same shoes into the coop and then take them into the house. And especially if you have a baby crawling around on the floor, there's potential for whatever's on your boots to potentially get picked up by the baby or by others. And so you see a lot of people who have great intentions. They want to get more involved in agriculture. They want farm fresh eggs. And they see an opportunity there, but they don't necessarily know that poultry like chickens, carry salmonella. It's part of their gut flora. And if you're not careful, you can potentially get infected with the salmonella or your loved ones. And so I think that's one of the things we saw. And there's other things like, what vaccines to give or what feed to feed or how to protect your chickens from predators. And I think a lot of times when people go into owning backyard poultry, they may not realize exactly what they're getting into. It's a lot of work.
From backyard poultry to big livestock operations, what are some biosecurity or human health, animal health things that you think are really important to keep in mind?
I think there are quite a few, especially, I will say, from about 2020 to present, we've had a front row seat to a lot of these types of things. I will say one of the things that comes to mind for me is the H5N1 influenza that happened. I think it was really interesting to see how a lot of dairy farms were subsequently affected by that. And it was also interesting to see how they utilized technology, because farms that actually had really great monitoring for milk production in place were actually able to detect a drop in milk output pretty quickly across herds and say, something might be going on here. Could it be this, or what could it be? And pick it up. I think that one of the lessons learned from that is around biosecurity and around not only wild birds, which I know is something that is always a conversation, is how do you minimize contact with either poultry that you're raising or your dairy herds with wildlife. But then beyond that, what about the equipment and the feed and the other things that are being brought onto your farm or taken off your farm? And how do you prevent bringing in cattle that may be infected into your herd? Or how do you, if you have an infection, how do you catch that quickly and potentially isolate those animals so that their milk is not necessarily going into your bulk tanks? So I think those types of things are really, really important. And I think H5N1 in particular gave us a front row seat to the need to have more of those conversations. And then I think one of the other things is really making sure that our labor is protected. So we have a lot of those who work on farms in agriculture, and they're at greater risk for potentially getting some of these zoonotic diseases, especially if they're not wearing appropriate protection or they're not aware that there's even a possibility that something like that could happen. And so I think we're fortunate in that there weren't very many cases of influenza that resulted as a after effect of the H5N1 coming through dairy farms and poultry operations. But I think that's something that we always have to be vigilant about. And it is preventable, which is the good news. Humans don't necessarily have to get sick from animals, and even vice versa. So there's some ways to mitigate that.
When you take a global perspective on animal human health, what are you keeping an eye on?
From my lens, I think one of the things I'm reading about right now in the newspapers is the northward movement of the New World screwworm fly. So this is a fly that was eradicated from the United States back in the 80s. And it's really, really a cool story because we used a sterile fly technology where female flies only mate once. And if they mate with male flies that have been irradiated, they will not actually lay eggs that are viable. Versus flies that lay eggs that are viable. They lay hundreds of eggs in one setting. They develop into larvae, and the larvae eat living tissue. So it's kind of the worst case scenario. But in the 80s, we used this sterile fly technique to actually push this back from the United States down past Panama. And in certain places in the Caribbean and South America, it continues to occur and be endemic. However, what we've seen over the last year is that we've seen some more northward movement of the screwworm flies. And so right now, especially in terms of the Western Hemisphere, there's a huge conversation about how many flies do we need, male sterile flies, to release and to actually push this back down. And we are seeing some northward movement in Mexico. And a lot of it is tied to movement of animals and movement of people. So both cattle moving northward that may be infected. The flies have the ability to fly and move northward as well. But also people. People can get infected with New World screwworm, not necessarily know they have it. They can jump on an airplane, travel, and then any place where some of those larvae are released, the larvae can grow into flies, the flies can mate, and you can actually establish it. And that's something that would have major, major impacts for agriculture agriculture, especially the cattle market. It's much less of a public health threat. It's not something that is transmitted person to person, so it's much less risk, although it is still a concern. But it could be devastating to agriculture in the event it were to come back and then get reestablished here.
While we're thinking about our farmers and ranchers, Megin, any notes or comments that you'd like to leave with them for our conversation?
I think my note is really a note of gratitude and appreciation. So we are incredibly fortunate that in this country we are able to go to the grocery stores and find fresh, safe, and affordable food and be able to nourish our families. And I think of all of the steps that go into that and all of the people that are behind that process and just incredible gratitude. And I think those of us who are involved in the science and the prevention aspects, we also want to do our role to try and keep that continuity going and make sure that that continues.
And as we are at K-State, if students are thinking about the public animal health sounds like a route for them, what words of encouragement do you have for them?
Oh, I'd say keep going. I think there are so many wonderful, dynamic opportunities in agriculture, whether it's animal science or some of the plant science. I think there are so many things that someone can do with one of these degrees. And so I would just say, especially if you're in the midst of studying for that big test or you're headed in towards finals, keep going, because on the other side of this, it is truly, truly worth it. And then I would say, as you get into your career, so this is thinking a little bit beyond that, don't shy away from the leadership opportunities, because we need more students like those from K-State to be represented in the leadership of our industry.
Megin, I appreciate you taking the time to join us today.
Thank you.
That was Megin Nichols, a veterinarian and public health leader with extensive experience at the intersection of human, animal, and environmental health. She has served in key roles addressing zoonotic diseases, food safety, and outbreak response, bringing expertise in how pathogens move between animals and people. And she is this year's 2025 lecturer for the Henry C. Gardiner Global Food Systems Lecture Series. Her lecture is titled "Where Animals, Data, and Decisions Meet, a One Health Journey." If you would like to hear this lecture, you will be able to hear the recording of it if you go to ksu.edu and navigate to the Gardiner Lecture Series. You can also look up Gardiner Lecturer K-State and probably be able to navigate through it through an internet search. I will, of course, link it in today's show notes on agtoday.net. Before I cut to a break, I would like to let you know about some upcoming beef quality assurance training and certification. There is one taking place Wednesday, October 22nd at the Holton Livestock Exchange. Dinner is at 6 and the BQA training starts at 6:30. You do need to RSVP by October 8th. There's also one taking place Tuesday, October 28th at the Franklin County Commission Chambers. Dinner is once again at 6 and BQA training starts at 6:30. Both of these trainings are done by Dr. A.J. Tarpoff, K-State Extension Beef Veterinarian. You can RSVP by emailing kbc@kansasbeef.org or by calling 785-273-5225. Once again, that number is 785-273-5225. We're cutting to a short break now on Agriculture Today, but we'll be right back.
Welcome back, and thanks for joining us on Agriculture Today. Along with Shelby Varner, I'm Jeff Wickman. We end today's program with this week's milk lines. K-State dairy specialist Mike Brouk says that if producers aren't testing the level of immunoglobulins in colostrum, they're just guessing as to whether the calf has enough to result in effective passive immunity.
Today I'd like to visit with our Kansas dairy producers concerning setting their heifers and young stock up for success as we go into the fall. You know, this time of year as we start to see the temperature swings and we start to see some health issues in our baby calves, one of the things we really need to pay attention to is how have we really set those calves up for success. And, you know, a lot of that actually starts with the nutrition of the dry cow. So as we think about those mama cows that are standing out there in pens waiting to have a calf for us this fall, how is their level of nutrition? Very, very important in terms of making sure that we have high-quality colostrum for the calf that she is going to have. Now, speaking of high-quality colostrum, one of the things I often find missing in our calf program is a measurement or determining what the level of immunoglobulins are in that colostrum. As we look at research data, about 20% of the colostrum that is produced by our cows may not actually have adequate levels of immunoglobulins. So if you really do not know what the level of immunoglobulins are in that colostrum, you're really just taking a guess. You can have everything right in the program, including the amount that you're feeding and the timing of that, but if you actually do not know what levels are, it's really hard to say whether or not you've actually fed the calf enough immunoglobulins to result in effective passive immunity. So, what is the easiest way to do that? Well, there's various things you can use to test the level of immunoglobulins in the colostrum. One of the probably easiest is actually the Brouk's fractometer. It's a device that can actually be used for several things. It can be used to test the level of immunoglobulins in the colostrum, but it can also be used to check the level of protein in the serum after the calf is born, and we're checking for effective passive transfer. So when you're thinking about what you should be looking for if you are using a Brouk's fractometer, you should be looking for a Brouk's reading of at least 22%. And the higher the better in this case, but we need at least 22% on that fractometer to have adequate levels of immunoglobulins in that colostrum. Now, another thing, if you purchase this device, which is not really very expensive, you can also use it to check whether or not the calf actually received effective passive immunity. We do that with a simple blood sample. We generally do this when the calf is about 7 days of age. You don't want to do it too early. You don't want to do it too late. And we check for the level of total protein in that serum of the blood sample. So blood samples can be separated easily on your farm. And again, you can use the Brouk's fractometer as a way to measure that. So what are we looking for as we look at the level of passive immunity that we'd like to see based on a Brouk's level? Well, anything greater than 9.4% when we're talking about serum collected from the calf would be what we would actually ideally like to see. If we're anything above 9, we're doing pretty good. As you drop below that, you get into the fair range, and if you drop below 8.1% on those serum samples, that indicates that we're not doing a very good job of passive transfer with the calves. Could be from a variety of reasons. Keep in mind, we'll always see a low percent in general. We'd like to see less than 10% that would fall into that poor category. Again, timing is really important, and it's important that we're setting these calves up for success, particularly when you figure the value of the calf in the market today. This is Mike Brouk with K-State Research and Extension, encouraging our Kansas dairy farmers to make sure that they have a good method to detect the amount of immunoglobulins in their colostrum, and also that they're checking for passive immunity in the calves through looking at serum protein levels.
Thanks, Mike. And that'll do it for this edition of Agriculture Today. For Shelby Varner, I'm Jeff Wickman. This is the K-State Radio Network.